The hospital. It may seem cold and clinical at first glance, but patients and families know that it's a place full of emotion, where drama unfolds and life can change in a second. The operating room is often the most dramatic room of all. Dr. Alan Hamilton, Harvard-educated brain surgeon, has seen it all.
I've been a brain surgeon for 25 years, and during the course of my career, I've had some experiences that are truly astounding. Things that medical science says shouldn't be possible.
In his new book, The Scalpel and the Soul, Alan reveals his extraordinary experiences. One of those cases involved a woman who underwent a special procedure that literally made her brain dead during surgery.
One of the most memorable was a young woman who had a blood vessel that had ruptured at the base of her brain. It's a very difficult area to get to. So one of the strategies that we had come up with was to put this woman onto a heart-lung bypass pump that would take over breathing and heartbeat for her, and then gradually cool her body down. And then when the time was right, her heart would stop and we'd turn the pump off. And then for a period of about 20 minutes, we'd have no blood flow. And the brain stops all electrical activity. She is completely dead by every criteria we have.
With the woman's heart and brain activity stopped, the doctors began to repair the ruptured blood vessel. Relieved that everything was moving smoothly, the doctors and nurses began to talk while they worked.
And during that period of time, there's conversation and banter. And in fact, one of the nurses sort of announced that she was getting engaged and had told us where she got her engagement ring.
After a successful operation, Dr. Hamilton visited the patient in recovery.
As we're talking to her, she starts telling us about this conversation, but word for word. I mean, right down to the jewelry store where they bought this ring. And we're sort of looking at each other going, that's impossible. Her brain had absolutely no electrical activity. So the question is, where were these memories made? And when they were made, how did they get back? The idea that a consciousness can exist and make memories independent of the brain and independent of the mind is a startling finding.
Dr. Hamilton believes that experiences like this are not isolated. Similar strange events occur every day at hospitals around the country, but doctors are afraid to talk about them. He hopes his new book, The Scalpel and the Soul, will break the silence.
I wanted both patients and physicians to feel free to embrace this, to talk about it, to finally bring the silence to an end. Not only do we need to address the physical needs during healthcare crisis, but we also need to address the spiritual needs. That, in a way, the soul needs as much intensive care as the body does.
These kinds of experiences have changed the way that Dr. Hamilton practices medicine.
I think a good physician uses everything they've got, including their intellect, their cognition, but they should also be using their intuition. And I always tell my residents, when the little hairs on the back of your neck stand up, you better listen to them.
To learn more, read The Scalpel and the Soul.